A few of the anxiety disorders that we're going to cover are generalized anxiety disorder, panic attack disorder, social anxiety disorder, and obsessive compulsive disorder, or OCD. So, when it comes to generalized anxiety disorder, this is where a person is going to experience excessive, global, and persistent symptoms of anxiety. It's pervasive, it goes throughout sort of all aspects of their life. We also call this free floating anxiety, and that's because it appears that once one source of worry is removed, another will just kind of come right back in and take its place. And so, if, for example, you're worried about your roommate taking a test, and the test is over and your roommate's done, and it's not even your test, it's someone else's, then the person, you might have something else come up. And so you would think, oh, well, the test is done, I don't have to worry about that anymore. Then something else comes in and takes its place, and you just start worrying about that thing. So this free-floating anxiety can be really troublesome because it never ends. To explain why people experience this generalized anxiety disorder, it's very likely a combination of environmental, psychological, genetic, biological factors, all probably involved in a person developing this. We can see that the problematic anxiety can be evident even at a very early age in a person's life. They may be 4 or 5 years old and say they're worried about money, they're worried about their parents having money. This is pretty common that we see early on in cases where people later on experience extreme anxiety. And of course, any kind of stressful experiences that happen early on in a person's life may contribute. So let's say that a child was homeless and had a major issue with food security or something like that. They may end up later on start to develop anxiety into later childhood and adulthood. Another anxiety disorder is panic attack disorder. So a panic attack is a sudden episode of extreme anxiety that's going to rapidly accelerate in intensity. So a lot of people who experience panic attacks feel like they're having a heart attack. They feel like their chest is tightening. It hurts. They might sweat. They're feeling like they can't concentrate. The world is sort of closing in around them. And many people do experience panic attacks just sort of randomly. But a panic attack disorder, which would be when you experience these panic attacks frequently and sort of unexpectedly. And so if you're in a situation where you're just sitting in a classroom and you're just listening to lecture, and then suddenly you feel a panic attack coming on, that's not triggered by anything in particular. Now, some people can recognize particular triggers, and for example, if you're claustrophobic and you go in a situation where you kind of feel like there's a lot of people around you, or you feel like there's a tight space, then that can sort of bring on a panic attack. But for some people, it's completely just triggered by nothing. Now, agoraphobia is another related disorder, agoraphobia, and this is where we see that a person is it's an anxiety disorder where the person is experiencing extreme fear of experiencing a panic attack or something embarrassing or incapacitating in a public situation where escape is impossible and they're not able to get help. And so this is very problematic for people, because what ends up happening is they don't leave their house. They never go anywhere because they're afraid that something's going to happen where they're going to have a panic attack. There are people who don't leave their home for 30 years. And today it's actually a lot easier to deal with agoraphobia because you can do things like order groceries and have them delivered to you. You can order things off Amazon and have it delivered to you. Well, 20, 30 years ago, it was a lot harder to have agoraphobia because you couldn't get things delivered to you like you can today. So this actually can contribute to people feeling more comfortable not leaving their home because they can get stuff outside of that. Now, some explanations of panic disorders could be oversensitivity to physical sensation. It could be a sort of a biological predisposition toward anxiety. The person might sort of experience a low sense of control over potentially life-threatening events, and all of these things could potentially contribute to a person having a panic disorder, but we don't know exactly what essentially causes it. Now, social anxiety disorder, this is one where a person's going to be fearful of being judged in a social situation. It's actually one of the most common psychological disorders. We find that more women tend to be diagnosed than men. The core of this social phobia is really this irrational fear of being embarrassed, judged, or critically evaluated by others. About 1 out of 8 adults in the United States has experienced social anxiety disorder at some point in their lives. And this is not just shyness. This is not somebody being shy. It's far more debilitating. A person who has social anxiety disorder is just intensely fearful. They won't even do ordinary activities like eating lunch in public, because that can cause unbearable anxiety, and it just really sort of scares them into doing anything. And so, this is something that can be really hard on a person who wants to have a life and wants to go out and do things. We see that there's some aspects of culture involved. So, for example, there is a condition in Japan where there are young men who are really fearful that their own appearance or smell, any facial expression or body language that they do in public might offend, insult, or embarrass other people. And so even though we see social anxiety disorder happening in other cultures, the way that it kind of manifests looks a little bit different from culture to culture. And so in those cases, there are many Japanese men who don't get a job, they don't, finish school. They're just so intensely fearful that they're going to offend somebody with themselves that they sort of hold themselves up in their own home. And so, again, this can just be really problematic for the person in terms of adjusting to life. Another particular anxiety disorder is obsessive compulsive disorder, or OCD. This is much more than just, I wish that all my pens were straightened, and I don't like it when things are out of order. This is a much more this is a much bigger condition than that. So this is characterized by the presence of intrusive, repetitive, and unwanted thoughts, repetitive behaviors, or mental acts that a person feels really driven to perform. And it's broken down into, obviously, obsessions, which is those intrusive, repeated, uncontrollable, irrational thoughts, mental images that cause you really extreme anxiety. For example, being fearful of dirt and germs, feeling like you haven't completed a task. So maybe, did I turn the lights off? Did I turn the oven off? And just that is an obsession that goes through your mind and is repetitive, and it won't change. Even if you go check, you still have this obsessive thought. And then, of course, the compulsions are those repetitive behaviors or repetitive mental acts, maybe counting, for example, that a person feels really driven to perform. It helps to reduce their anxiety and distress, and it might even prevent a dreaded event or situation. People can do this overtly, sort of outwardly, or covertly, kind of secretly. And so, some people can actually spend hours just trying to get out of the door of their house because maybe they have to, switch their light on and off 10 times. Maybe they have to wash their hands so many times. Maybe they have to, check something 10 times. And then, if anybody interrupts them, they have to continue and start over and continue again. There are people who are so fearful of dirt and then wash their hands to the point where the layers of skin are removed and their hands bleed. So this is definitely something that is a troublesome disorder. Many people know that this isn't typical. They don't want these obsessive thoughts, and they don't want to do the action, so they're not happy with it. They don't want to experience this, and so then they want to be treated. And so this is something where a person knows this isn't normal, and I want my life back. And so they usually do seek out treatment to treat that. So some explanations of OCD is that it could be a deficiency in some neurotransmitters like serotonin or epinephrine. It seems like when we give medications that increase serotonin and norepinephrine, some of the symptoms decrease. So that tells us that those neurotransmitters are probably important for this disorder. We also see that there's some dysfunction in certain specific brain areas. Those areas that are involved in fight or flight seem to activate inappropriately when they're not supposed to. Some frontal lobe activity when probably more excessive than it should be. And then we see the caudate nucleus, which is important for regulating movements. We see some heightened activity there to potentially explain what's going on with OCD. Now, another category of disorders are the depressive and bipolar disorders. These are emotional disorders, or categorized as such. They have distinct categories in DSM-5. And the idea is that these emotional disorders are violating the norm, right? So they could be impacting the quality, intensity, or duration of a typical emotion or mood. And so that's what we look for in terms of diagnosing these disorders. So major depressive disorder is where we see that a person is experiencing really extreme and persistent feelings of despondency. They feel worthless and hopeless and helpless. Their emotional side obviously is affected because they're experiencing this very down mood for a really long time. The cognitive side of things, it can impact the way that they're thinking. They may have repetitive and intrusive thoughts. They might have what we call ruminations, where it's like, you think over and over again, why am I here? And, maybe even thoughts of harming themselves. Obviously, it's going to impact behavior, impact where you're going, impact what you're doing. We see physical functioning impacted as well. Some people just ache and they hurt. It's going to impact your social life because you may not want to go anywhere or talk to anyone or do anything. You may not want to go to work, may not want to go to school. So it's going to impair a lot of areas of your life and cause distress. About 6 to 7% of Americans are affected by major depression, with a lifetime prevalence about 15% of Americans experiencing major depressive disorder at some point in their lives. Women are about twice as likely to be diagnosed with major depression. It could be that women feel that they have a lesser sense of personal control. It could be that women do report experiencing a greater degree of chronic stress, and that could be adding to it. It could be some neurological explanation, but unfortunately, we just don't know exactly why women tend to be diagnosed more so than men. When we are diagnosing major depressive disorder, we have to see that the person is experiencing so many of the listed symptoms for at least 2 weeks or longer. We can see that in some cases, those persistent depressive symptoms may not have any explanation. It may just be that the person is experiencing depression and they have no idea why, or it could actually be triggered by a specific event. So if a person is going through bereavement, where they have lost a loved one, it could be even a pet, it could be a best friend, it could be a family member, it could be a significant other. That can of course trigger major depressive disorder, and that grief can cause depression. Another kind of branch of this is seasonal affective disorder, or SAD. This is where we see it's a particular mood disorder that typically occurs during the fall and winter seasons. Usually during the spring and summer, the person doesn't feel depressed. It's where a person actually has a very specific and unique cluster of symptoms where they may experience intense hunger. They might be hungry all of the time, eat a lot, and that usually leads to them gaining weight. Usually this occurs in the winter. They tend to sleep more than usual, and they tend to experience depression later on in the evening as opposed to during the day. And there is treatment, of course, for this that is a little different. Turns out that seasonal affective disorder can sometimes be treated really successfully with bright light. So if you have a person exposed to 10,000 lux of bright light within 30 minutes of waking for 30 minutes during the morning, it turns out that it actually really does improve their symptoms. And so we find that many people who are in areas where they're experiencing more darkness during the day, the season, they tend to be more at risk for seasonal affective disorder. So, for example, if you live in Alaska, where you might have 30 to 60 days of darkness, then you are going to be more likely to experience seasonal affective disorder. So another sort of branch of depressive disorders is persistent depressive disorder. This is a sort of a milder form where a person is experiencing a chronic sort of low-grade mood, very depressed mood. It's not quite severe enough for a diagnosis of major depressive disorder, but is absolutely causing them distress in their life. And so this is something that could be in response to a trauma. It doesn't decrease over time. It can actually coexist with other depressive disorders. So this is just one that seems like a sort of a milder version, but it is definitely persistent enough to be considered a diagnosable condition. Another emotional disorder is bipolar disorder. And it's called bipolar disorder because we're talking about two ends of the poles. We're talking about a person who's experiencing severe and extreme mood swings where they are, intensely happy. And what we mean by intensely extreme euphoric, we call this mania or manic. And then they experience the other end of the pole, which is intense depression. So a lot of times we see that a person experiences a manic episode for a short period of time, and then very immediately after they experience major depression. But in this case, the depression usually lasts longer than the manic episode. And some people do report that they feel more creative and they feel like they get stuff done when they're manic, but not everybody, prefers to feel that. It can be very extreme, and sometimes people feel very uncomfortable because they feel very manic. And they know that directly following that's going to be a major depressive episode. There's only a small percentage of people that only experience manic episodes and no depression, but we're seeing these abnormal moods in most cases of bipolar disorder at both ends of the emotional spectrum. These are people that are cycling. Sometimes they might experience it over a period of weeks, sometimes hours, but usually we're seeing it over a period of time. So we may see that a person is experiencing rapid cycling, or they might be experiencing it, every few days to a couple of months. This used to be called manic depressive disorder, and then the name was changed to bipolar disorder. So if you ever hear anybody say manic depressive disorder, this is the same condition as bipolar disorder. It's been broken down into two major categories, with the more severe version being bipolar 1 and the more milder version being bipolar 2. These are, these are disorders where we see about having about a lifetime risk of about 1%, and there doesn't seem to be much of a gender difference in terms of prevalence. Lithium is a choice medication usually for bipolar disorder, and so that is one way to treat it. When it comes to now, bipolar 2 is a milder version, but there's an even milder version than bipolar 2 called cyclothymic disorder, and this is where the mood swings aren't as severe, but they do last significantly longer. So you might experience these mood swings for 2 years or longer. They're not quite severe enough to be called bipolar, not quite severe depressed enough to be called major depressive disorder. A lot of times people are sort of labeled as being really moody, kind of unpredictable, maybe inconsistent, kind of flaky. And so it can be very frustrating to somebody who is not diagnosed yet. And they feel like something's wrong with them. Now, there's a lot of very famous people that have come out and said that they're diagnosed with bipolar disorder. So here we have Demi Lovato, who is a singer, Scott Stapp, which is a singer of Creed, Catherine Zeta-Jones, Jean-Claude Van Damme here, and then it was proposed, of course, he was not actually officially diagnosed, that Vincent van Gogh perhaps had a bipolar disorder. There's a lot of suggestion that there is a genetic predisposition to bipolar disorder. When you look at family, twin, and adoption studies, it does suggest that there's a genetic predisposition. There's also some theories circling around brain chemistry. We know that antidepressants can help lift the symptoms of depression, and that works by increasing norepinephrine and serotonin in the brain. So perhaps not having enough of that can trigger depressive episodes. Because lithium alleviates symptoms of mania and depression, the idea is that maybe glutamate is a neurotransmitter that could be impacted by bipolar disorder. And so again, we're kind of using this by process of elimination. Give this medication, we see that it impacts these neurotransmitters, and that must be what is going on with that particular disorder. Now, switching gears a bit to personality disorders. Now, personality disorders are really interesting. We have to consider kind of the fact that personality disorders tend to be ones that are hard to diagnose because a person doesn't necessarily think that there's anything wrong with them. So we typically see very inflexible, very maladaptive patterns of thoughts, emotions, behaviors. Their interpersonal functioning is impacted. This is something that's usually stable over time, stable over situations, and this is something that is a deviation of the individual's cultural expectations. So the expectations of the culture. This is not something that this is considered a deviation of typical behavior. And because these are maladaptive, because they're inflexible, we find that a lot of people tend to not know that there's anything wrong with them. And the reason why they get diagnosed is usually because a loved one is giving them an ultimatum. If you don't go and get counseling, if you don't go get treatment, then I'm leaving you, or I'm cutting you off, or whatever. So a lot of times a person is not considered their personality characteristics as being problematic in any way, even though it's causing them problems in their life. They don't see it. We really see that the personality disorders, these maladaptive patterns, really start becoming super evident during adolescence or early adulthood, and that's going to follow them throughout their lives. And so these the personality disorders that we're going to talk about are categorized into basically three clusters. We have the odd, eccentric, dramatic, emotional, erratic, and anxious and fearful. And I've got a table here to kind of break some of these down. So the odd, eccentric cluster includes paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Now, what's important to note about, because some of these look kind of similar, these odd eccentric clusters are not schizophrenia. That's a completely separate disorder, which we're going to talk about. And that is something that is I just want to make sure that you're very aware. So schizoid personality disorder would be a person who's really detached from society. They may experience and display very little emotion or pleasure in really anything. A schizotypal person is going to have impaired social interaction, impaired thinking. They're going to come off as very peculiar, kind of off key, doesn't fit in. And so, we're looking at people who are just kind of odd and off the wall, but obviously they don't think anything's wrong with them, and they're just kind of, living their life and doing their thing. Now, the dramatic, emotional, erratic cluster includes antisocial, borderline, histrionic, and narcissistic personality disorders. And I really want to highlight a couple of these. So, antisocial personality disorder, this is one that is typically seen to be a person tends to look very manipulative. They can be kind of charming. They tend to be really cruel and destructive when you get down to brass tacks. During childhood, they may be actually diagnosed with conduct disorder, where they are not really, they don't really care about other kids. They might hurt other kids. They might hurt animals. This is something that we see very young in in children who might torture cats or dogs. They don't really have any kind of regard for life and any regard for other people's property. They tend to start fires. They seem to lack a conscience. They don't seem to care if they hurt people. We do find that this tends to be a little bit more prevalent in men than women. There's a high rate of alcoholism and other forms of substance abuse in this. And so as the person kind of goes into adulthood, having come from this conduct disorder diagnosis, usually as a kid, we're seeing that, these behaviors tend to kind of follow them. Now, one really important point here, and I really, really want to point this out, is the idea is that a psychopath and a sociopath are actually not diagnosable conditions. We often look at a person that we say is a psychopath or say is a sociopath, and we end up diagnosing them as antisocial personality disorder. Now, the distinction between a psychopath and a sociopath is a psychopath really has no sense of morality. A psychopath is somebody who's going and murdering a bunch of people. They don't really have any sort of feelings of guilt. They're just kind of doing what they do, and they're murdering them for whatever reason they want. A sociopath does appear to have a sense of morality. They may do really heinous acts, but they have a explanation for it. They may see themselves as a martyr. They may see themselves as doing God's work, or doing a God's work, or doing whatever's work. They may be doing it for religion. They may be doing it for because they feel a sense of morality on their part, and they seem to have some sense of morality. It's just skewed. So a sociopath is doing it for reasons. A psychopath is doing it because they want to, and they just don't care. So if you're going to cross paths with a psychopath or sociopath, psychopath is definitely one that you don't want to cross paths with. But neither one of these are actual diagnoses. These may be kind of under the umbrella of a person with antisocial personality disorder. These people tend to be, which make up to about 1 to 4% of the population, tend to be very manipulative, can be very charming, but ultimately are very, very cruel and manipulative people. Big thing here is that psychopath and sociopath may be kind of underneath the antisocial personality disorder, but are actually not diagnosable conditions. Borderline personality disorder, I actually have another slide for that, so we'll get into that. Histrionic has been, this is one where we see a person is acting very dramatically. They tend to go over the top. They are hysterical at times. If you say, for example, that the ice cream machine is down, or, at McDonald's, they may scream and flail on the floor. It's just somebody who's, tends to have particular traits that are just not very conducive to, to society. Narcissistic personality disorder is a tough one. This can look a lot like borderline personality disorder. This is where a person is very much stuck on themselves. They think that that the world revolves around them, that they, don't need to worry about anybody else, and that everyone needs to kind of cater to them. And this can be really hard to deal with if you have a family member with this, because they don't think anything's wrong with them. And they can sometimes be very, very difficult to deal with, because they are very inflexible with just dealing with on a daily basis. So I'm going to get back to borderline personality disorder here in a minute, but I want to cover these anxious, fearful. Avoidant personality disorder, dependent personality disorders, these are ones that are under that anxiety category. But again, remember that these are individuals that don't feel like this is causing them problems, even though it may change their outward behavior. Obsessive compulsive personality disorder is very different than OCD. OCD is a condition where the person knows that there's something wrong. They want to fix it. They want to get treatment, and they want to live a quote unquote normal life. A person with OCD personality disorder, or obsessive compulsive personality disorder, This is a person who's very, very inflexible, very strict. They don't want to change. They're not going to change their day. They're not going to change their schedule for you. This is a person who could have a huge temptation right in front of them, but they refuse it because it interferes with their schedule. This is a person who is very, very inflexible and very strict for their whatever they're doing in their lives. But this is, the key difference is that they don't think anything's wrong. They're fine with the way they are. They may be more type A personality, and they don't care. They're just, they're like, this is who I am, and if you don't like it, too bad, move on. Now, borderline personality disorder, remember, this is that dramatic, emotional, erratic cluster. This is a very debilitating condition. A lot of psychologists do not have a lot of clients who have borderline personality disorder because it can be very difficult to work with people who have this particular disorder. We find that about 1.2 to 6% of the population may have it. About 10% of the people who meet the criteria for borderline personality disorder actually commit suicide. And it is characterized by instability of interpersonal relationships, instability of self-image, emotions, a lot of impulsive behavior. And the idea is that this is a really serious and debilitating personality disorder. It's one of the worst personality disorders to deal with. The person experiences a very intense mood, very fluctuating extreme moods, very often out of proportion. For example, if the person is upset, they may immediately say, well, I'm going to go kill myself right now, and there's nothing you can do about it. Or if you leave me, I'm going to hurt myself. They tend to have very chaotic relationships because they're very afraid that somebody's going to abandon them. So if you work with somebody and you're a psychologist and you work with somebody with borderline personality disorder, they may come to your place of business every single day. Do we have we have an appointment this week. Are we still good? Are you still my psychologist? Are you still working with me? Are you still my friend? Having a family member with this could be somebody who's, texting you every day. And if you don't respond immediately, they immediately think that, you no longer want to be with them, or you're no longer family, or you're no longer, going to like them anymore. We find that there's a lot of self-mutilation behavior. A person might cut or burn themselves, just to kind of feel something. Sometimes it's a show, and sometimes suicide attempts are real. And successful. And so it's really difficult to know if a person is actually threatening, and they're doing it for show, or they're actually going to go through with it. And so this is definitely something that is scary to deal with if you've ever had anybody in this kind of, with this kind of disorder, personality disorder, because you don't know what to expect with them. It's always sort of chaos. We see that women tend to be diagnosed more so than men. People in lower incomes tend to be diagnosed more so than higher incomes. We see Native American men actually being diagnosed more often. The lowest incidence appears to be in women of Asian descent. We're not really exactly sure why, but there must be some sort of biological explanation potentially, or genetic explanation for that. Some of the early views as to what causes this is potentially some disruption in attachment relationships in early childhood, maybe some sort of neglect or physical, sexual, or emotional abuse. But it looks like that the theory behind what's causing this is probably more so related to a combination of biological factors, psychological factors, and environmental factors. And so, this is kind of the best